trauma cases I deal with could be either due to personal injuries, road traffic collisions, or occupational. And the majority of the times it's all about an incomplete assessment. So if we, just to illustrate this, the case on the left, this lady took her kids out to a zip wire kind of event, and another child on the zip wire knocked into her lip, causing a bad laceration. And you think, well, you know, that will heal. So why is it a big issue? The problem is when she went to A&E, they fixed the lip, but actually didn't remove the bits of teeth within the lip. So she had recurrent infections, which end up with very bad scarring. So it was an incomplete assessment by someone not within the specialty. But to be honest, this can also be missed by people who work within the specialty. So it's all about complete assessment and getting imaging or an X-ray to make sure there's no foreign body. This unfortunate gentleman this is an occupational injury when he should have been wearing a face guard, and a reciprocal saw basically came away, and this was a health and safety executive inquiry type thing. And he again was seen within oral maxillofacial surgery. The face was repaired, but they missed a fracture of the jaw underneath. And this was again a litigation, as he needed to go back to theatre and get that addressed. And there was also nerve damage, which was not picked up at the time. This poor girl went in for a normal procedure for a tonsil procedure, actually, and they knocked one of the teeth out. The anaesthetist knocked the tooth out. There are strict guidelines to say, well, if you knocked a tooth out, you need to do X, Y, and Z. Unfortunately, they didn't. And the tooth was left in a bag and handed to mum several hours later, by which time it was too late. Then it was replaced into the socket by the anaesthetist, but unfortunately the wrong way around. Anyway, suffice to say, the tooth was lost. She ended up with a permanent gap, and the other tooth migrated into the gap. So now she needs quite complex orthodontics. So here we'd get a report from an orthodontist as well as a surgeon, and will require implants at quite a high cost. And when you put an implant in, you know, that's not guaranteed lifelong, so you may have to have it replaced. So there are issues of quantum down the line. Just one thing to say about the trauma cases, maybe for not this case, but the others, we do recommend, but suggest when you ask the question, do you need any other expert opinion? It's usually a psychologist, because a lot of them tend to have post-traumatic stress disorder following the trauma.